So next chapter, Kushta Chikitsa from Charaka Chikitsa Sthana, seventh chapter. So due to intake of Virodhi Annapana, Viruddha Virya or Viruddha Ahara, especially Drava Snigdha Guruni, which increases the Kleda, Ama. So this all will cause Kushta. So this point is important. Shitoshna Langana Aharan Kramam Muktva Nishevana. Frequently asked question. This is one of the FAQ question. Means if a person using Shita Ahara or Shita things, suddenly if he is exposed to Ushna things, there will be change in the membrane potential of skin or skin's overall reaction will change us. So it will disturb the skin's integrity and it may cause skin diseases like Kushta. For example, a person um, wandering in the daylight sunlight with a warm temperature, suddenly if he get into ATM or AC, so there will be sudden changes in the or sudden fluctuation in the metabolism or skin temperature regulation. So there will be changes in the skin's reaction. So Shitoshna Kramam Muktva. Person in Ushna directly entering into Shita or a person sitting in AC for a long time suddenly is exposed to a very extensive sunlight. So these things will change the skin's condition. So that will reflect in skin diseases. So that is Shitoshna Langana Aharan Kramamuktva. Person who is dieting continuously suddenly takes heavy food, or a person taking heavy food continuously suddenly go for Langana. So these are all things will cause skin reactions or skin potential will changes causing kushta. So Garma, Shrama, Bhayartanam, Drutam, Shitambu Sevinam. One who is affected to exposed to excessive sunlight, Garma, one who is continuously undergoing Shrama, one who is exposed to Bhaya, suddenly he if he takes Shitambu, cold water, then there will be sudden fluctuation in the body's overall water metabolism. So that will result in skin diseases. The next is Panchakarma Apacharina, excessive Snehapana and not doing Shodhana. So that will cause Kushta. Intake of Virodhi Ahara. So these are all the causative factors for Kushta. Some of the special one is Vipran Gurun Garshayatam. If a person curses the Brahmins or Vipras, Gurus on Papa Karmacha Kurvatam. So these are all some of the distant causes for Kushta. So next, Dravya Sangraha means seven factors in Kushtas or Vatadayo Trayo, that is Vata Pitta Kapha. Then Tvak, Rakta, Mamsa, Ambu. Tvak, Rakta, Mamsa, Ambu. These four factors. So 4 plus 3 total Saptaku Dravya Sangraha. These are all the seven factors responsible for presentation of Kushta. So Vata Pitta Kapha, Tvak Rakta Mamsa Ambu or Dushta Tvak Rakta Mamsa Ambu. So Kushtas are innumerable based on their causative factor, presentations, intensity, doshic factors, dhatu factors, places of Kushta. Based on this, Kushtas are innumerable, but still a classification is done that is seven types of Mahakushta, Ekadasha types of Shudra Kushta. And one more interesting feature is no Kushta is developed by only one dosha. Na eka doshajam kinchit kushtam samupalabhyate. Means every kushta is a combination of tridosha. Based on their predominance, it may be vata pradhana kushta, pitta pradhana kushta, kapha pradhana kushta, but every kushta is made up of tridosha. So na ekadoshajam kinchit kushtam samupalabhyate means there is no kushta which is developed only by sole dosha. It is always a combination of tridosha. So this may come as a reference question. This may come as a fill in the blanks. Nacha ekadoshajam kinchit dash samupalabhyate. So what are the pururupa of kushta? Sparshagnatvam, sensory loss, atisvedam, nava, either excessive sweating in some lesions or no sweating in some lesions. Vivarnium, discoloration, unnati, indurations, kotanam, papules like loma harsha, horripilation, kandu, toda, shrama, klama, vranana, madikam, shulam. These are important features. Vranana, madikam, shulam. In general, normal wound will have more pain when there is an underlying kushta. Shigra utpatti sthira sthiti. So the wounds, ulcers will develop very fast, but it will take very long time to heal. So that is shigra utpatti sthira sthiti, chira sthiti. Daha suptangata. So these are all some of the pururupa of kushta. Ashtadasha kushtas will be explained. So first one is Kapala Kushta or Mahakushtas, Kapala, Udumbara, Mandala, Rishyajihva, Pundarika, Sidma, Kakanaka. So these are all the seven Mahakushtas. So when comes to the chapter of Kushta, so there are lot of differences of opinion among the acharyas. Sometimes name may be same, but the presentation may be changes. Sometimes doshik combination may be changes. So there are differences of opinion between Charaka, Sushruta, and you can compile Charaka, Sushruta, Ashtanga Hridaya, and Madhav Nidana. So you have to compile these four for considering the Kushta. So types of Kushta according to Charaka, Mahakushta according to Charaka, Mahakushta according to Sushruta, Mahakushta according to Ashtanga Hridaya, Mahakushtas according to Madhav Nidana. You have to compare. For example, uh, Sidma. Sidma is a Mahakushta in Charaka Samhita, but Sidma is a Shudra Kushta in Sushruta Samhita. So, like this, there are differences of opinion. Difference of opinion with respect to doshic predominance also there. So, you should make a comparative chart among Charaka, Sushruta, Vagbata, and Roganita, Madhavanita. So next is Shudra Kushtas. Among the Shudra Kushta, Eka Kushta, Charmakya, Kitiba, Vipadika, Alasaka, Dadru. Dadru is Mahakushta in Sushruta Samhita, whereas Dadru is Shudra Kushta in Charaka Samhita. Charmadala, Pama, Vispotaka, Shataru, Vicharchika. So these are all the Shudra Kushtas. So first one is Kapala Kushta. Kapala Kushta is characterized by Krishna Aruna Kapalabham. It looks like a burnt earthen pot, broken earthen pot like Madike. Broken earthen pot like it will appear. Ruksham Parusham Tanu. So this is the Kapala Kushtam. So there will be Toda Bahulam. Sometimes there will be more pricking type of pain. So Tatkushtam Vishamam Smrutam. Irregular pattern. So that is the Kapala Kushta. We can compare with tuberculoid lesions. Tuberculoid lesions. Next one is Daha Kandu Ruja Raga Paritam Loma Pinjaram Udumbara Falabhasam. So it looks like a fruit of Udumbara. The lesion looks like a fruit of Udumbara, mainly Pitta Pradhana Kushta. It is Udumbara Kushta. So it can be compared with leprosy. So next one is Mandala Kushta. It will be reddish, whitish in nature. Shvetam, Raktam, Stiram, Styanam, Snigdam, Utsanna Mandalam. So it is characterized by extensive induration, elevation, Utsanna Mandalam. Kruchram, Anyonya Samsaktam. So all the lesions are interconnected. Anyonya Samsaktam means small lesions will make a big lesion. So that is Anyonya Samsaktam. So that is the Mandala Kushta. So this is also in different types of lepromatous lesions. Next one is Rushya Jihva, where it is very rough, Karkasham, Rakta Paryantam, Antaha Shavam, Savedanam, there is a painful lesions. Rushya Jihva Samsthanam, Rushya Jihvam. It looks like a deer's tongue. Jihva means tongue, Rushya means one type of a deer. So this lesion looks like a tongue of a deer, like lesion. So that is Rushya Jihva. Next one is Pundarika. Pundarika is characterized by whitish, Shweta, Rakta Paryantam, whitish, pinkish coloration. It looks like a Pundarika Dalopam, as if like a lotus petals. There is a Utseda, elevation, Daha, so that is called as Pundarika Kushtam. It will have a combination of Kapha and Pitta, Pitta and Kapha, so that is Pundarika Kushtam. Leprodermatosis. Next one is Sidma Kushta. Sidma Kushta can be compared with some vitiligo like white patches like Shvetam, Tamram, Tanum, Chayadraju, Krishtam, Vimuchyate. There is a plaque like presentation. Krishtam, Vimuchyate. Alabu Pushpavarna. So, whenever there is a comparison with a specific uh, famous comparison, so the Alabu Pushpavarna. So, that is the Sigma Kushta. Whitish pinkish color pushpa, alabu pushpa. So the lesions looks like whitish pinkish color. So hence it is alabu pushpa varna. So entrance point. Alabu pushpa varna is a dash kushta, sidma kushta. Next one is kakanantika. Kakanantika means gunja phala. Kakanantika word meaning is gunja phala. It will have a combination of red and black. Red means it looks like a uh, neoplastic like. Black means it may be churned or ischemic, necrotic, gangrenous. So these are all the other features. Combination of a neoplastic plus gangrenous lesions. It is a Kakanantika kushta. So in some kustas, especially like lepromatis or leprosy, there will be first there will be inflammation. Next there will be transformation. Then it will change destruction. There will be destruction like features. Next, there may be ischemia, necrosis, gangrene, or it may turn into malignancy. So, combination of all these things is Kakanantika Kushta. So, Kakanantika Kushta is malignant plus gangrenous, necrotic, hence it is a Asadhya Kushta. The next one is Shudra Kushtas. First one is Eka Kushta. Eka Kushta is characterized by Asvedanam. There is no sweating. Asvedanam. Mahavastu, it occupies a large area. Mahavastu. Matsya Shakalopamam. This is the most entrance point. Matsya Shakalopamam. It looks like a fish flakes of fish skin. So that type of presentation, it is called as ichthyosis. In modern parlance, it can be compared with ichthyosis, severe form of dryness with plaque formation ichthyosis. Interesting point is Ekakushta of Sushruta Samhita is entirely different. Ekakushta of Sushruta is Sarvadaikam Krishnatvam, complete black discoloration of lesions or region is called as Ekakushta. So in Sushruta Samhita, the name of the Shudra Kushta is same, but presentation is different. Here it is ichthyosis, there it is complete blackish pigmentation or blackish discoloration. Next Kushta is Charmakya, Bahalam Hasti Charmavat. It looks like a elephant skin. Atopic dermatitis or severe form of exfoliative dermatitis looks like a Hasti Charmavat, like a elephant skin. So that is called as Charmakya. Next one is Kitiba. Kitiba is characterized by Shavam, Kinakara Sparsham, Parusham, Kitibam. So Kitiba in Sushruta Samhita is like a eczema, wet lesion, but here it is a Parusham, rough lesion. So Kitiba of Charaka Samhita may be psoriasis, Kitiba of Sushruta Samhita may be eczema. So there is a uh, various difference of opinion in with the presentations. So Kitiba, psoriasis according to Charaka Samhita, Kitiba according to Sushruta is a eczema. Whereas in Charaka Samhita, eczema is Vicharchika. Vicharchika is Sakandu Pidaka Shava Bahusrava Vicharchika. So Vicharchika is eczema from Charaka Samhita, whereas Vicharchika in Sushruta Samhita is psoriasis. There it is characterized by rough lesion, rough roundish flakes like induration. So that is looks like a psoriasis in Sushruta Samhita. So don't get confused. So first make a list of Charaka Samhita. You by heart it, you get to know about the lesions clearly and then compare with Sushruta Samhita. Then it will be easy. So Vicharchika according to Charaka is a eczema. Vicharchika according to Sushruta is a psoriasis. Kitiba according to Charaka is a psoriasis, whereas Kitiba according to Sushruta is eczema. So just different of opinion or different versions, but names are same. Next is Vaipadika. It is a palm psoriasis, sole psoriasis. So Panipada Sputanam Tivra Vedanam. Dadru. Dadru is like a fungal infection, ringworm like Dadru Mandala Sa Kandu Raga Pidika. There is a severe itching sensation, redness, and small papules. So Dadru Mandala can be compared with ringworm infections. Asrugdala. Asrugdala is characterized by vesicles, sac and spota. Palma. Palma is characterized by Kandula, severe itching sensation, Pidaka brusham, multiple small papules. So that is Palma. One type of dermatitis, allergic dermatitis can be considered with Palma. Vispota is characterized by spota, vesicles, pus filled or fluid filled vesicles. So that is Vispota. Shataru. Shataru is characterized by Bahu Vranam, multiple ulcers or multiple lesions. Shataru. So immune compromised tuberculosis lesions can be considered with Shataru. Vata Pradhana Kushtas are Kapala Kushta. Kapha Pradhana Kushtas are Mandala Kushta. Pitta Pradhana Kushta is Audumbara Kushta. Whereas Kakanaka is Tridoshita. Vata Pitta Pradhana is Rushyajipa. Shleshma Pitta Pradhana is Pundarika. Vata Shleshma Pradhana is Sidma Kushta. Whereas Charmakya, Eka Kushta, Kitibam, Vipadikam, Alasakam. So all these are Vata Kapha Pradhana. Pama, Pama, Shataru, Vispota, Dadru, Charmadala. They are Pitta Shleshma Pradhana. Vicharchika is Kafapraya. So these are all the doshic influence in 18 kushtas. So all kushtas are tridoshajam. Based on their balabala, based on their predominance, they can be grouped into Vataja, Pittaja, Kafaja or Vata Pitta Pradhana, Dvandvaja kushtas. Next. So you can't name each and every kushta. So based on the presentation, predominance of Vata Pitta Kapha, you should go for the treatment. So if there is a predominance of Vata, there will be presentations like Rauksha, Shosha, Toda, Shulam, Sankocha, Ayama, Parushyam, Karabhavu, Harsha, Shava, Arunatum. So these are all presents Vataja Kushta Lakshanas. Next, if there is a Daha, Raga, Parisravas, excessive secretions, Paka, separation, Vistragandha, foul smell, Kleda, Angapatanam, underline this one, Angapatanam. So these are all Pittaja Kushta. Whereas Shwaityam, whitish, cold lesions, excessive itching, Styrium, Mutseda, indurations, elevations. So these are all the Kapha Pradhana Kushta. And Jantubir Abhivakshanam, excessive creamy. You can see the visible creamy kleda in Kapha Pradhana Kushtas. So what is the treatment? If there is a Vata Pradhana Kushta, Vatottareshu Sarpir, Shleshma Pradhana Kushtas, you can do Vamana. Whereas Pitta Pradhana Kushtas, you can do Rakta Mokshana, Virechana. So in Kushta, wherever there is a Sparshanindriya Nashanani, wherever there is a loss of sensation, so in those conditions, Shastra karma should not be done. Wherever there is a loss of sensation, those lesions, Shastra karma is contraindicated. There, Shara karma, Rakta Mokshana can be done. So different types of sarpes are mentioned. Tikta sarpes, which are mentioned in previous chapters, can be utilized here. Iti Mustadi Churnam. This is for internal as well as external applications. Underline this one, Lelitaka Prayoga. Lelitaka means Gandaka. It is a type of Gandaka. Underline the word lelitaka. Lelitaka means gandaka. So next is Madhvasava. Madhvasava already we have seen in Prameha. The same thing is Madhvasava. So Madhvasava is present. Madhvasava is present in Prameha as well as Kushta. In Madhvasava mentioned in Prameha is also indicated in Kushta, and Madhvasava mentioned in Kushta, it can be given in Prameha. So next there is a description about Kanaka Bindvarishtam. Kanaka Bindvarishta, there is Kanaka. Kanaka means golden. So it looks like a golden color. So there is no gold in this. There is no gold content in this Arishta, but it looks like a gold, hence it is called as Kanaka Bindvarishta. So different types of lepas have been mentioned, not so important for entrance. You can utilize for practice, but for entrance you can skip all these things. Different types of lepas. So next is Tikta Ikshwaku Adi Tailam. Tikta Ikshwaku Tailam. Kanakakshiri Taila. So all these can be asked as a adhikara. Kanakakshiri Taila is explained in dash chapter, or what is the adhikara of Kanakakshiri Taila. Like this question may arise. There will be no questions with respect to their ingredients will not be asked. Not so important. You can skip it. Next is Kadira Gruta. Kadira Gruta, Maha Kadira Gruta, Tikta Shatfala Gruta. So there is a Kshira Shatfala Gruta already mentioned in Gulma. This one is Tikta Shatfala Grutam. Maha Tiktakam Grutam. In Maha Tiktaka Grutam, main ingredient is half of the ingredient is Amalaki. Maha Tiktaka Grutam. Next is Maha Kadira Gruta. Best for Kushta Vikaran. Param Kushta Vikaran. It can be given in all types of Kushta. Maha Kadira Gruta. So speciality of this chapter is there is a description about Shvitra. Shvitra, even though it has similarities like Sidma, but it is mentioned separately as a Shvitra because there is a severe form of depigmentation. There is a loss of pigments in the skin. So Shvitram directly in any of the chapter we don't find first treatment and then description, but only in case of Shvitra first treatment is mentioned. Shvitre Stramsanam Agryam with Malapurasa. Malapurasa, with the help of Malapurasa, Stramsana should be done for the Shvitra. So in continuation of Kushta Chikitsa, it is mentioned treatment of Shvitra first and then description of Shvitra is mentioned later. So this is the only situation where the order is missed. So first usually there will be description of the disease, prognosis and finally treatment will be mentioned. But here first treatment is mentioned, followed by order, description of the disease. So Shvitra Main treatment is Tramsana with Malapurasa. Shvitra we can compare with different types of vitiligo. So three types of Shvitra can be seen: Darunam, Charunam, Kilasam. Daruna, Charuna, Kilasa. So three types of Shvitra. Whenever there is a Rakta Shrite, it will look like a Rakta color. Mamsa Shrite, it looks like a Tamra, coppery tinge. Meda Shrite, if the Shvitra is located in the Meda, affecting the Meda, then it looks like Shweta, whitish color. So Shvitra, which are Parasparatu Abhinnam, means if there is no gap between the patches, multiple patches are there, there is no gap between the patches, means that there is a large Shvitra, and the loma also turns into Rakta color. Even the loma is also affected by Shvitra. Usually loma color, body hair color is blackish brownish, but if it turns into reddish color means even the Roma is also affected by Shvitra. So hence this type of Shvitra naiva siddhiti, it is incurable. Whereas Arakta Loma, if the Loma is not transformed into red color, Nati Chirotitam, not a very chronic lesion, Madhya Avakashu, if there is a space between the patches, it is Sadhya. So that is the Sadhya Shvitra, Asadhya Shvitras. So that is about the Pushta Chikitsita. We'll move to the next chapter, Raja Yakshma Chikitsita. Raja Yakshma is divided into four types: Sahasajanya Raja Yakshma, Vega Sandarana Janya Raja Yakshma, Kshayajanya Raja Yakshma, and Vishamashana Janya Raja Yakshma. So it is in detail mentioned in Nidahasthana, all four types, their occurrences, classification, how they progress into Raja Yakshma have been mentioned. So there is a story behind Raja Yakshma, mythological story which is affecting the Chandra. So Chandra was married to 28 uh, daughters of mm, don't remember the exact story. So, but Chandra has been married to 28 ladies because of excessive sexual intercourse, all those things. Chandra was affected with Raja Yakshma. So that is the mythological story related to Raja Yakshma. So here there will be Ujo Nasha, loss of severe immunity, severe loss of immunity. So that will cause become a platform for infection. So multiple infection can occur. One of the infection modern parlance is tuberculosis, pulmonary tuberculosis. So there are three words in Raja Yakshma. One is Shosha, Kshaya, and Yakshma. Shosha means Rasadi Dhatunam Shosha. If there is a dehydration or deficiency of Rasadi Dhatus quality, quantity decreases, then it is called as Shosha. If there is a decrease in their functional aspect or integrity or immunity of aspect of Rasadi Dhatus, Rasadi Dhatunam Karma Kshayam is equal to Kshaya. If there is a Karma Kshaya, their functional loss. So when there is a physical loss as well as functional loss, so overall their integrity and immunity will be lost, and it will be a easy platform for infections. Any bacteria, virus can attack this body and cause multiple infection, multiple presentation, and that is called as eczema. When there is a multiple presentations, multiple diseases combined, so then it is called as Raja eczema. So that is the story behind Raja eczema. So first one is shloka number 14 to 19. It is about Ekadasha Rupa of Sahasajanya Rajakshma. If excessive Sahasa is done, if excessive exercise are done, it will cause a chest injury. It will cause a weakness in the body. Because of this, there will be Rasadi Dhatunam Shosha, then Rasadi Dhatunam Karmakshaya, so which will affect the severe form of infection. One of the infection is tuberculosis infection or pulmonary tuberculosis like infection can occur, which will present into multiple presentation. So these are all the presentation: Parshvashula, Jwara, Kasa, Shodita Stevana, hemoptysis, etc. etc. So total it is Ekadasha Rupa Sahasajanya Rajayaksha. So usually there will be not any questions. Identify Sahasajanya Rajayaksha based on this presentation. Like this question may not arise in AAPGT, so we can skip all these things. So next one is by Vega Dharana, by Vega Pratigata, there will be Ekadasha Rupa Rajayakshma. So suppression of Vega will leads to Dhatu Kshaya, Dhatu Shosha, and then finally resulting in multiple infection, multiple presentation, that is Rajayakshma. So Vega Vidarana Janya Rajayakshma. So next one is Kshaya Janya Rajayakshma. One is physical Kshaya, that is body's direct physical Kshaya, excessive activity, excessive panchakarmas, and another one is excessive sexual intercourse. Because of this, there will be retrograde Kshaya, Shukrakshaya followed by Majjakshaya to Astikshaya to Medakshaya, like this. Retrograde Kshaya can occur or Anuloma Kshaya can occur. And because of psychological things like Shoka, all those things, there will be Kshaya. So there will be Rasadi Tatunam Shosha, Kshaya, and finally resulting in Rajayakshma. That is Kshaya Janya Rajayakshma. Last one is Vishamashana Janya Rajayakshma. Whenever abnormal ahara is taken at a different time, different places, proper digestion do not occur, that will cause formation of ama, and all these ama will cause obstruction of the GIT tract. Rudva, the dhatus will not get the proper nutrition. So all the dhatus will go into Kshaya, Shosha, and Rajayakshma. So that is the Vishamashana Janya Rajayakshma. So remember all the four types of Rajayakshma has been presented in detail, and all the Ekadasha Rupa is present in all the four types of Rajayakshma. Puru Rupa of Rajayakshma is also important. There will be Pratishaya, sneezing, Dorbalyam, Dosha Darshanam, Adosheshu. This is a psychological perversion, finding fault in everything, adosha, even though if it is normal, still finding faults. So that is called as dosha darshanam adosheshu. Kaye bibhatsa darshanam. The body becomes very weak. There will be muscle loss, fat loss, etc. So body looks bibhatsa, horrible. Balamamsa parikshaya. So there is a more desire for sexual intercourse, to take more madhya, mamsa priyata, as there is a severe form of Kshaya, severe form of Kshaya in immunity, there is a more interest in taking non-vegetarian, Mamsahara, Madhya, etc. Keshanam, Nakanam cha Abhivardhanam. So there is excessive growth of Malarupi, Kesha and Naka. In Swapna, in dreams, the person will see everything empty. Jalashayanam, Shailanam, Vananam, everything look empty. So these are all the Puru Rupa of Raja. So in Rajekshma patient, any food taken will not be digested properly, and most of the food will be converted into mala. So anything available source of energy for the Rajekshma patient is mala. So uh, a Rajekshma patient never should undergo Virechana or Shodhana, all those things, because mala is important. Tasmat Purisham Samrakshya Visheshat Rajekshmana. So even Purisha should be protected. So there is person should not undergo excessive evacuation, etc. So sarvadhatu kshayartasya balam tasya hi vid balam. So this may come as a entrance point. Sarvadhatu kshayartasya dash balam hi dash balam. Balam tasya hi vit balam. So wit or the fecal matter is the only source of energy. Shloka number 48, 49. There will be excessive pratishaya in Rajayakshana. So there are some different presentations like pratishaya, kasa, shwasa, aruchi, atisara. So these are all different types of presentations in Rajayakshana. So each may be present like a separate disease, but in relation to Rajayakshana, they are the common. So hence these diseases have been mentioned in detail, that is description of pratishaya, description of kasa, etc. So in kasa there will be pichilam, bahalam, vistram, haritam, greenish color, whitish color, yellowish color type of sputum will be seen in kasa. Trirupa Rajakshma is amsa, parshva, abhitapa, pain, rise of temperature in chest region, rise of temperature in scapular region, etc. Karapadayoho daha, jwaraha sarvangascha. There will be fever, feverish nature in all over the body. There will be Swarabeda, abnormal voice. This is again because of Vata, Pitta, Kapha, Rakta, Kasa Vegat, Sapinasa. So these are all the causative factors for Swarabeda in Rajakshma. So there will be Arochaka because of Rajakshma. There will be Arochi, Arochaka, etc. So Rajakshma treatment always goes in the form of Avastikam. Avastikam means at a particular time, at a particular stage, at a particular stage of disease, what is the main presentation? Rajashma may present with multiple presentation, but at a particular time, what is the main presentation? If there is Atisara is a prime presentation, then you should treat the Atisara. If Kasa is the prime presentation, you should treat the Kasa. If Aruchi is the prime presentation, you should treat the Aruchi. If Swarabeda is the prime presentation, you should treat the Swarabedas. Like this, Parikshya Avastikam Vaidyaha Shoshinam Samupachari. Means Avastika Chikitsa, based on the Avastha of the disease, you should go for the treatment. This is the Sitopaladya Churna. Sitopaladya Churna. Ingredients are important. Sitopala, Tugakshiri, Pippali, Bahula, Tvacha. Antyadurdvam Dvigunitam means from last to starting, you should increase the dose. Tvacha, one part means Bahuyela should be two parts. Pippali should be four parts. Tugakshiri should be eight parts. Sitopala should be 16 parts. So that is Antyadurdvam Dvigunitam. It should be taken with Madhu and Sarpi. Anupana is Madhu Sarpi. So this Sitopaladi Churna, it is useful in Shwasa, Kasa, Kafaturam, Supta Jiva. If there is no taste in the Jihva, Supta Jiva, Arochaka, Alpagni, Parshvashula. So in these conditions, Sitopaladi Churna can be given. So if there is a severe form of Hasta, Pada, Angadaha associated with Dwara, etc., can give Vasa Gruta, Shatavari, Siddha Gruta. So next, there is a description about Yavani Shadava. Yavani Shadava is useful in Arochaka. So in this Yavani Shadava, people is 100 people should be taken and Maricha should be 200. 200 Maricha should be taken. So that is Yavani Shadava. Next one is Talisadya Churna or Talisadya Gutika has been mentioned. So in Rajakshma conditions, there will be Stroto Roda will be there. The dhatus will not get the proper ahara, etc., because of the Stroto Roda. And Dhatu Agni Shaya will be there. So to improve this, Madhya is indicated. So Madhya will clear the Stroto Vibandha Mokshartham, Bala Pushtyartham. So Madhya Pana is indicated in the um, Rajakshma. So Sukha Madhya means limited dose of Madhya should be given with a proper Anupana in case of Rajakshma. So that is the treatment modules for Rajakshma. So I am not going into much details about Rajakshma because most of the things are vast and it will be useful for practice, not for entrance. So there is no specificity. So the points which we have discussed here are the points with respect to specific entrance questions, entrance based points. So for practice, it has to be studied in detail in a different way. For entrance, this is the better method.